Welcome back to another episode of the Skinfluence Podcast. I'm your host, Dr. Dustin Portela, board-certified dermatologist. And today we are going to be talking about everybody's favorite cosmetic procedure, Botox. And I'm joined, as always, by my co-host, Austin.
Hi, I'm Austin. I'm a physician assistant. I've been practicing with Dr. Portela now for a year, but doing dermatology for almost 10 years.
So a lot of people are curious about Botox. Some people are hesitant about it. Some people want to go au naturel and avoid the needle all of the time. When was the first time you got Botox?
Oh, the first time I got Botox, I was probably 27 or 26 when I first started practicing. And of course, we provide Botox to our patients, and I need to know what it feels like. So that's when I did it, and I've actually kind of maintained it. You can kind of, I don't have a lot of movement there.
No, it's looking pretty good. I am definitely due for more.
Oh, yeah.
So I always do my own, but I think I need to just sit down and let you do it. Because when I do my own, it's hard to poke yourself with a needle.
I don't know how you do that.
And so I do numbing cream for
I would have to
30 minutes before. And then sometimes they still hurt, but I can get through it. But then because I have to go through all this process, I got to have extra time, and I just don't do it very often.
I'm happy to do it anytime.
All right, I'll take you up on that.
But this is a great topic because I remember growing up back in the day, my mom's friends all did Botox, but no one really talked about it. It was kind of taboo. Now, no one even lifts an eyebrow.
Yeah. That is great. So let's get into the meat and potatoes of what this is. What Botox actually is that it's a neuromodulator is what we call it. And essentially that's medical speak for saying it does something to interfere with the communication from the nerve to the muscle. Because all of those muscle movements in our face or anywhere in our body start in the brain. They come out the nerves, and the nerves send a signal to tell the muscle to contract. And we don't need to go through the whole physiology of actin and myosin and all of that, but essentially the nerve flips a switch and tells the muscle, do your thing.
Yep.
And Botox interferes with that process.
Yeah, Botox blocks the nerves from releasing a neurotransmitter telling the muscles to contract, basically, acetylcholine.
Acetylcholine. It's a very common neurotransmitter in the body. It does a lot of different things. And we have this little protein inside the nerve called SNAP25. And inside the nerve, there's these enzymes that make acetylcholine. And then the acetylcholine goes to this protein at the surface of the nerve, at the edge, at the wall, called SNAP25. SNAP25 takes it, engulfs it, and spits it out the other side.
Sends it across.
Botox basically blocks the ability of SNAP25 in doing that. So the acetylcholine gets to the wall and it can't get through.
Yep. Thus making it so the muscles cannot contract.
Right. They just won't get a signal to contract. And when Botox hits SNAP25, this little protein, it permanently blocks it. It's destroyed. So you might be thinking, why isn't Botox permanent?
Yep.
Well, your body will always be making new SNAP25 protein.
Exactly.
But that process takes
about 3 months.
About 3 months. And that's why Botox lasts about 3 months.
Yep.
When people are coming to you, Austin, for Botox, what are the most common areas that you treat?
So some of the most common areas I get asked about are around the mouth or lines that they're seeing here. And we definitely don't treat those areas because you want to be able to move the mouth. The areas that we mostly treat are the forehead, the glabella, the little lines, the 11s between the eyes. We also do around the eyes for the smile lines. You could do the nose for like the bunny lines for people who talk with their nose or smile a lot with their nose. Occasionally for like the orange peel chin, you could do a little bit down in that area, but that's less common. Mostly I would say around the forehead, eyes, that type of area.
Yep, exactly. Those are the most common. It was first approved for the treatment of the lines between the eyebrows. And Botox can treat any muscle that it gets to. So it is important to be aware of the anatomy. And I always say it's very easy to stick a needle in somebody and push a product, but it's very important to know the anatomy so you know where these muscles start and end, where the belly of the muscle is, because you want to get the active ingredient, that Botox, in the right place. And if you put in too much or you're not quite in the right place, the Botox can travel. It's just a liquid once it gets under your skin, and you don't want it to migrate to the wrong place.
Exactly. They try to mitigate that a little bit by putting proteins inside of the formulation of Botox to help it not move so much. And some have less of those proteins or smaller proteins. For example, Dysport. So Dysport travels a little bit more in the skin, but there's things that they do to try to mitigate that. I remember one time I was relatively comfortable doing Botox years ago, and I had someone come to me, a coworker, who said, I just clench in my sleep. Could you do my masseters? And I was like, I've never done the masseters, but I'm willing to do it for you if you had done before. And like, yeah, you just put it right here. And it was way too far forward.
Oh, no.
And I was like, we didn't get the masseter, and she couldn't smile.
You got the buccinator.
Yeah. So she was like, she would smile, but you couldn't see her. She couldn't pull the mouth out all the way. I was like, okay. Yeah. Learned your lesson there.
Yeah. The another area that I do treat with Botox is what's called the depressor anguli oris muscle, which comes from the chin up to the corner of the mouth.
Yes.
And when that has too much tension, we call that RBF.
Yes, RBF.
So, and if you don't know what RBF means, I'm not going to repeat it. You can Google that. But you have to be very precise in your injection there.
Yeah.
Because if you go too far medial, you're going to hit something called the depressor labii inferioris. And then again, their mouth is going to droop.
Their mouth will
But
droop.
if you hit the depressor anguli oris, it just allows the corners of the mouth to come up a little bit and just give you a little more happy look at rest.
Yeah, it curls up a little bit. Yeah, definitely have to be careful about that area because it's tempting to kind of do Botox around that area, but if you get too close, it'll prevent you from being able to move the mouth as well. So you have to certain things you can do, providers can do, have you frown, move the muscles to find exactly where that needs to be, because it's always a little bit different for most people. Everyone's anatomy is slightly different.
Yeah.
So.
Do you have a lot of people that ask you for the lip flip?
Yeah. Lip flip's becoming more and more popular.
Yeah.
As people are doing less filler in the lips, they want to do less filler and then add a little bit of a lip flip on top of that.
Do you like doing the lip flip? Do you see good results with it?
Most people are pretty satisfied. It's subtle. It's not like a drastic change. It's the point of it is to try to show the lip more, so people have flatter lips on the outside, try to curl it up, relax the muscle. It's difficult to drink out of straws afterwards, but I've had pretty good success with it. It does hurt. It's not the most, it's more painful than like the forehead and areas like that, but I've had good success with that.
Yeah. The muscle that we're treating there is called the orbicularis oris, and that is a circular muscle that runs all the way around the upper and the lower lip, and it's the one that allows you to pucker like that. When you hit that muscle, we're relaxing it just a little bit. You have to go very low on the number of units, the amount that you're injecting. So what I find is that people really like the result, but it doesn't last the full 3 months.
No.
So you're getting maybe 4 to 6 weeks out of it because we use this muscle all the time.
Yeah.
So we're always contracting it, and you're not putting in enough to really knock out a lot of those receptors. So recovery happens faster than it does when we're treating other areas of the face.
Totally. If I'm doing a lip flip, I'm using 1 unit on each of the areas. Typically, I know people who do 2, but is that about?
Yeah, I do about 1 unit or so.
Yeah,
you can go more, but then they will have trouble drinking out of a straw. They maybe not be able to whistle.
Yes.
Or other activities.
Things that I warn my patients about because I don't want them to be frustrated that I can't drink out of my straws now or my Stanley Cup.
Yeah,
so.
Exactly. You did mention, and I have seen this as well, that a lot of people come in and say, oh, I don't like these lines here. I don't like these lines. Can you do Botox here? We should get into the difference between Botox and filler.
Totally.
So filler is creating volume in the skin. You're putting something in there that's going to take up space. And we're using hyaluronic acid most of the time. We've touched on this on our lip filler episode. So it's taking up volume. It's going to stay in the tissue. We say for 6 to 12 months, but studies have shown sometimes it's there for years.
Yeah.
But Botox is not adding any volume. Yes, we have liquid in the syringe, but the liquid is just there to carry that little Botox protein to the right place. And then your body absorbs the saline and gets rid of it. So we're not adding any volume. So if you don't like lines on your lower face, Botox is not going to fill those lines.
No, Botox isn't going to fill in, like you said. It's something that does need to be understood by the patient sometimes because they get they see things online or they feel like Botox will help that area and they should not be talked into doing anything. That filler will fill in that area, but Botox definitely shouldn't be used. Typically, the rule of thumb is below the nose. You typically don't use it, but like those areas that we talked about, lip flips, chin, and the orbicularis oris.
Yeah. The DAO.
The DAO.
Yeah.
We can use it there, but very, very small amounts go kind of below the eyes.
Yeah.
Higher amounts you can use in the face depending on how strong the muscles are.
Yeah.
But yeah, never really below the face very commonly, especially for around the mouth or deep set lines.
So walk us through the process, Austin. If somebody coming in to get Botox, what does the preparation look like? What does the injection look like? And then aftercare. We should touch on all of those things.
So typically when a patient comes in for Botox, I like to go over what it is because sometimes there's obviously misconceptions that we had talked about. So I go over what Botox is, what it's doing, and its goals. Because people a lot of times will think if you get Botox and once it sets in, those wrinkles are gone. And that's not necessarily the case. Keeping up with the Botox can diminish the wrinkles over time. But all it's doing is stopping your muscles from folding. I talk about folding paper. The more you fold a piece of paper, the harder it is to get that wrinkle out. Botox is preventing you from folding that paper, creating wrinkles in the skin. So I go over kind of what the expectations are with Botox. We'll go over how long it takes to set in because it takes about it takes a few days to start taking effect, but usually about 2 weeks to see its full effects. We clean and prep the area, usually with just alcohol swabs.
So it's a good idea if you're coming in to get Botox, don't wear makeup. I know sometimes you're coming right from work and everything, but you can step into the bathroom at the practice and wash your face. Otherwise, I'm just going to clean you off with alcohol, and I'm only doing
just
the areas.
In those areas.
Yeah, and so then it looks a little funny. So
yeah, or if you have to go back to work, bring makeup with you, and then you could retouch up those areas. But we talk about how when you leave the area, you're gonna have little what looks like bug bites all over your skin. But so we clean, prep the area, and then we administer the Botox. It doesn't take very long to do. The whole procedure probably takes, depending on how much you're doing or where you're doing it, 5 minutes, 10 minutes, and then we'll re-clean the area, go over expectations once again. And then sometimes if my patients are new to Botox, I may have them come back in 2 weeks to see how it's setting in. And then we can touch up from there if we need to. If they're Botox pros, we know exactly how much their body needs and what works well for them, then we'll see you back in 3 months.
Now, if you're coming in to get Botox, you do need to plan a little bit what you're going to be doing the rest of that day.
True.
So it's not a good idea to go work out intensely. You're going to start sweating. You're going to be moving those muscles. There's the chance that the Botox could spread to undesired areas. My mentor, before I got into dermatology, he had done this for one of his nurses, and she had heard the spiel all of the time.
Yeah.
And she went immediately and got a massage after that. And she was laying down on the pad on her face, and it just compressed and it pushed the little Botox areas. And she ended up with a droopy eyebrow for, a couple of months. So don't go get a massage. Don't work out intensely.
Yep.
Don't go do, physical labor where you're putting your head down. You kind of just want to take it easy.
Take it easy. Be sitting upright for at least the rest of the day.
Try not to sleep on your face. It's best if you can sleep on your back.
So if a patient comes in for Botox, how much do you typically charge?
Yeah, everybody wants to know what it costs.
What does it cost?
And this varies widely from practice to practice and location in the United States. You're for sure going to pay more if you're getting this done in West Hollywood or New York than you will in a lot of other places. When I was in my residency, we charged $12 per unit at that practice in Michigan. And that's a pretty standard price. I think most places have probably raised it a little bit because that was 10 years ago. And you just charge by the unit. One vial of Botox has 100 units. On average, to treat an area, it's around 20 units. So 20 times 12, they're going to end up paying $240 at that practice. What I noticed, though, especially for first-time users of Botox, is that if they needed a little more, they just spent, $240, and they were still moving more than they would like. They'd come back, they'd get another 8 units, and then you're asking them for another $74 or whatever it is.
Yeah.
And they're just not happy. They're like, I already paid for this. So when I opened Treasure Valley Dermatology, we made the decision that we would charge by the area. So the glabella would be an area, the forehead would be an area, the crow's feet, both sides would be an area, and we would charge $300 per area. And then it doesn't matter how many units somebody needs. We're going to make sure they get the result. I like to tell patients, you're buying the result. You're buying my expertise. You're not buying a product. And so we give them the number of units that we think will deliver the result that they're looking for. We talk about, do you want to be totally frozen? Do you want to maintain a little bit of movement?
Right.
Are we correcting for an asymmetry, whatever that is? And then 2 weeks later, they can come back. And if they need more, I touch it up for free. Yeah. And in doing that, I've never had an unhappy Botox patient because they're not having to open their wallet a second time.
Totally.
They knew they paid for a result and they're getting that result.
Yeah.
So, and that's the way I like to do it. It doesn't mean that other practices who charge by the unit are doing it wrong. They do whatever works for them, but that's worked really well for us.
Yeah. That's exactly how I've been doing it. And, the goal is for the patient, the client to leave here satisfied with the expertise that we're providing and to end up coming back to our practice. Mm-hmm. And so taking care of them is number one. And so if they come back and they say, hey, I have a little bit of movement, we can touch it up. That's greatly appreciated. A question for you. Common thing that people think about when they think Botox is they think frozen face, but you had mentioned that you can still maintain some movement with Botox.
Yeah. It really depends on what your goals are, and you have to vocalize that with your injector.
Yeah.
So they're going to be trying to set expectations with you. You need to set your expectations with them as well. And if you want to maintain a little bit of movement, have a bit of a more natural look, you don't want to be frozen like the Real Housewives or the Kardashians or something like that. There was maybe we should link it in the show notes, but somebody stitched together a video of like the housewives crying, like all the different times they're crying.
I think I've seen this.
And their faces are just not moving. And
yes.
it looks eerie. It's so strange because you're sensing this emotion, but you don't see the emotion because their faces can't show it.
Yes.
So if you want to have a little bit of movement as an injector, I'm going to treat with fewer units. We're not going to put enough in to knock out all of those receptors. So you're going to get some motion. It's going to be relaxed. And Botox sets on over the period of a couple of weeks, and it wears off over the period of a few weeks.
Sure.
It's not like you wake up one morning, you're frozen, the next morning, all of your movement is back. It's a gradual process.
Yeah.
And so when you're, not treating to that frozen state, which we rarely do, except maybe in the 11s. It doesn't impact the appearance too much to really freeze that, but the forehead in particular.
Forehead, typically, we want you to be able to express yourself a little bit, but not so much to where you're causing wrinkling of the skin, and that is attainable with Botox. We don't just freeze people's faces whenever we inject Botox. So, yeah, I think that's an important aspect of Botox that people may not understand is they think if I get Botox, I'm going to look like I can't move my face. But you can express yourself. I can get mad at my kids still. So
the important things.
So,
well, before we continue on with this conversation on Botox, let's jump into a little bit of Did You Know?
Okay.
All right, Austin, we just came back from the American Academy of Dermatology meeting.
We did.
And I would be remiss if I didn't bring up the Neutrogena party with Snoop Dogg.
Oh, yeah, I want to hear about it.
So the AAD is a great meeting with a lot of educational content. There's sessions going on for 5 days where you can learn about surgery, severe skin disease, common skin disease like acne and rosacea, whatever your interests are, whatever you want to learn more about.
Yeah.
But it's a great networking opportunity. All of the companies have booths there where you can go and see what their new innovations, their new products are. They give away a lot of samples. And as long as I have been aware of the AAD, even talking to older physicians who've been doing this for years, the AAD has parties.
This is a new thing for me. I didn't know that until this
So
this
back
conference.
in the day, the pharmaceutical companies would throw parties where they would spend millions of dollars. And then as regulations changed and pharmaceutical companies couldn't throw these big parties, then it was the path labs that were throwing the parties. And then the over-the-counter companies started coming into that space because they want that attention. They want people there taking, selfies and videos, and they get that earned media value when everybody posts it on social media. And this year, I think Neutrogena probably threw the biggest party the AAD has ever seen.
Oh, the most memorable one.
Most memorable for sure. There's probably been bigger as far as the number of people. They did keep this exclusive.
Yeah.
And they never announced that Snoop Dogg was going to be the special musical guest at this party.
They kept it under wraps very well.
So there was a lot of speculation on it because Martha Stewart was the keynote speaker at the American Academy of Dermatology meeting.
Yeah.
And, I think most people, you think Martha Stewart, you think Snoop Dogg and vice versa. It's like the most unlikely duo ever.
She walked out to Snoop Dogg songs.
Yeah. So the party was going on. They closed the doors at 9:30. It opened at 8. They closed the doors at 9:30 so nobody else could get in. And I am part of this company called Air Health.
Yeah.
And it's a way that patients, customers, anywhere in the United States can get over-the-counter skincare products from Neutrogena, from Elta MD, from so many other companies at a discount for the lifetime that you maintain your account.
Yeah.
So Neutrogena is one of the big sponsors. They partnered with Air to throw this party, and they got Snoop Dogg to come and perform. Because I'm on the board, I did know about it, but I couldn't say anything. And I had the privilege to go and be a part of the meet and greet, which was only like 20 people.
Oh, really?
Mm-hmm. And so I got to, before he came out on stage, I got to go up to this private room, and Snoop Dogg and his entourage were there.
Nice.
The air, they must have had a fog machine in there because there was all this smoke in the air.
There was, in the videos that I saw, he came out till there was like smoke and fog on the ground.
So I'm sure it was just a fog machine. But I got to go up, get my picture with Snoop Dogg. He's very tall and super nice, just a super gentle guy, very conscientious. And he just seems like he just loves his life. He's super happy.
Oh, yeah, he should.
He should, absolutely. So I got to go meet Snoop Dogg. And then after the meet and greet was over, at about 10 o'clock, everybody was gathering around the stage because, the DJ was doing his thing. But clearly there's a stage. Everybody knew there was a musical guest. And there was enough speculation that everybody knew what was about to happen.
Yeah.
And the door opens on the side, and Snoop Dogg runs on stage, and he performed with incredible energy for almost an hour.
That's wild.
Yeah.
That's awesome. And he's not young.
No, I think he's in his 60s.
He's in his 60s?
I don't know. Maybe I'm not giving him enough credit. We're going to search this on the fly.
Dang. If he's in his 60s, I'm impressed. We got to check
Oh my gosh. Snoop Dogg is only 53, so Snoop,
just a little off.
I don't think you're going to see this, but if you do, man, I'm sorry. Your skin looks great. It really does. Yeah, that's glowing. Why we were giving you a lot of credit for thinking you were in your 60s. Like you look great. Yeah. So Snoop Dogg is 53. I misspoke. I should have known that before I met him.
That's okay. He's been around for so long.
I know. We've all grown up on Snoop. Yeah. And so
he's like our grandpa.
Yeah, Grandpa Snoop. So that was awesome. That was my pseudo did you know is I got to meet Snoop Dogg at the Neutrogena AAD party.
All right. Well, since your did you know was something that happened at AAD, mine is something that happened around the time of AAD, and mine is I hate flying.
Oh, really?
With a passion. I don't know why. I think it's just that I have no control over getting to the airport and going through security, and there could be lines. I slept 0 hours the night before my flight. I stayed up all night watching The Office.
All night watching The Office.
Watching The Office. That's my my anxiety for flying is I just can't sleep. I'm worried they're going to change my flight. And I sit there. I don't know how you fly so much. I'm always like...
I have just resigned myself that I have no control over the situation. And if things go south, I'm just like, all right, I'll just figure it out. Yeah. I can't do anything about it.
Everything ends up okay always. I hate it.
And presumably then you don't sleep on the plane either.
No, I'm awake on the plane. I get lightheaded on planes.
Yeah?
I sit there and I'm like, I get woozy. I don't know. I'm getting old.
We got to find you. I'm going to give you some Tro-Calm. I've got these calming lozenges.
Let's do it.
It's all completely legal substances, but they're just like herbal supplements to help calm you down.
For when I fly.
All right. We'll hook you up with that.
Yeah. So I got through, I don't know if you've seen the Superfan episodes of The Office.
No, I don't think so.
They're great.
Yeah.
Yeah, it's all the deleted stuff.
Oh, okay.
So that's what I watched all night before my flight home. So did you know I can't sleep before flying? And I love The Office.
All right, as we move back into Botox, we know that I'm due for it. And I'm treating the wrinkles that are there. I mean, I have dynamic wrinkles and I'm starting to get static wrinkles. Static wrinkles are those where you can start to see the lines at rest. And I used to get away with Botox a couple times a year, kind of more preventative. It would knock out those dynamic wrinkles that only show up when you move, when you animate. But now I haven't been doing it enough that I'm like, when I'm on Zoom, I start to see the 11 lines starting in there. And I'm like, I got to do this more often. So Botox for prevention, like what age should somebody start Botox if they want to stave off those wrinkles from ever developing?
Okay, so great question. I have men and women in their down into their 20s coming in and saying, is Botox okay for me? And the answer is yes. If you prevent the skin from wrinkling, you will prevent those deep set static wrinkles like you had mentioned. So you may not need as many units starting that young as if you started later, but Botox can be preventative starting younger.
Yeah.
Just depends on what you want.
Right. When somebody's coming in for the preventative aspect, I also recommend they don't do it every 3 months.
Right.
This might be something you do once or twice a year. I liken Botox to putting your arm in a cast. If you have ever broken your arm or your leg and you're in a cast for 6 or 8 weeks, you know when that thing comes off, you got this scrawny arm on one side. And when you're not using a muscle, it will start to atrophy. It'll start to get smaller. And if you are 25 and you start doing Botox every 3 months, that muscle is just going to get thinner and thinner and thinner. And then you're going to start to notice more without that muscle that you can see the veins in your forehead more easily.
Yeah.
And that's not a desirable look either.
Nope. Yeah. So it is important to be careful about how often you use it, how many units are being used, and then the location. Most people in their younger 20s, unless they're really expressive around their eyes, I probably wouldn't put it around the eyes, but mostly focused around forehead or glabella. Now, someone comes in and then they ask, I want to prevent my glabella. I want to prevent the 11s from showing up, but they don't want to touch the forehead. Yeah. Is that something that you would just treat the glabella and not touch the forehead, or would you recommend a few units in the forehead?
Yeah, you can certainly focus just on the glabella. The main muscles there is something we call the procerus, right in the middle, and then the corrugator muscles, which come from just above the eyebrow, kind of middle, and go down. And they just pull that whole unit down, and we can just target those muscles. You may see a little bit of spread up into the forehead, but it's minimal. It shouldn't really express your ability to raise your eyebrows.
Yeah.
So it's the most common area that I treat is would just treat the glabella.
Yeah, by far the most common is the glabella.
Just like any medical procedure, Botox is not without its risks. And of course, we've talked a lot about the benefits of Botox, but possible side effects, we can touch on some of those. The most common thing that can happen when you get Botox is bruising. We're putting a needle in the skin and you have blood vessels all over, both big and small. We generally know where those big blood vessels are at. But there's, thousands and millions of little tiny blood vessels. And if one of those gets punctured, you could have some bleeding underneath the skin. And you could have a temporary bruise that lasts for a week or so.
The bigger muscles, like the procerus muscles, are a little bit more vascular. So sometimes you can bruise in those areas a little bit easier. Around the eyes can bruise a little bit easier. That is another reason why we don't recommend exercising within the same day or 24 hours of getting Botox, because you're increasing blood flow and you can bruise in that area. But bruising, definitely one of the main side effects that we see. Droopy brows is another side effect. So if you inject the Botox too low in the forehead, you're going to drop the brow. And you can do some things to try to correct it a little bit, but sometimes you're just going to have a little bit droopier eyebrows. Some people will want us to drop the other one to try to make it look more natural, but I typically don't do that. When
you have a droopy brow or it just feels heavy, usually that's not going to last all 3 months too. Because we treated the forehead and something just spread a little too far. So the amount of product that's actually worked its way down to that critical part of the muscle is not a lot, but it may be there for a month. And
that's one of the risks that we go over, and we try to make sure that is explicitly understood. It's not super common. I mean, understanding the anatomy, if you understand people's anatomy and you watch how they move their forehead before you inject Botox, it's a relatively uncommon thing unless they're doing something where they're laying on their forehead or massaging it and it's moving and migrating a little bit. What are so there's different brands and different types of Botox that we see on the market. Is there a difference between all the different brands, or are they similar, or is one better than the other? Common questions that I get.
Yeah. In my mind, I approach them all as being relatively similar.
Yeah.
The most common, the first one was brand name Botox.
Yep.
And like Kleenex, there's, you buy the Walmart brand of tissues, but everybody just calls them Kleenex.
Yep.
But we just say Botox as a general category for neuromodulators, of which we have Botox, we have Xeomin, Dysport, Juvo, and what was the most recent one that lasts a little longer?
6 months. Daxify.
So the other one is Daxify. Daxify was brought out last year, and they market it as something that lasts about 6 months.
Yeah.
So it costs the provider a little more. You're probably going to pay a little bit more. We don't offer it at our practice. We actually only offer brand name Botox in Xeomin.
Yeah.
Because I think they're all so equivalent, it just doesn't make sense to keep inventory of all of the different ones.
Yeah. I think so. Xeomin is always good to have because that's called it's called a naive type of Botox where it's a naked type of Botox. There's no proteins added or protective proteins added in it to try to get the Botox to the muscle. So the protective proteins that are put into brand name Botox or Dysport, they do help enhance the effects of Botox by getting it to the muscle, delivering it, and helping it last a little bit longer. But people can build antibodies to those proteins, and then you basically get used to it, and it doesn't take the same effect. So having Xeomin on hand is a great backup because it's protein. It's a naive or naked type of Botox, so it doesn't have those. You can switch to that, and it can take effect.
And I almost exclusively use Xeomin on myself.
Oh yeah,
and I really don't notice it all lasts about the same.
Yeah, so it all lasts about the same, but. So Dysport, the protective proteins that are put in it are smaller, so it has more of a spread. Botox brand, the protective proteins that are put in it are a little bit larger, so it has less of a spread. So if you're doing more, that one's great for if you really need to pinpoint a specific area. That's good for that. Things like lip flips and things like that, Botox is good for. Dysport, I wouldn't use around the lips so much because it has a little bit more of a spreading effect, but we don't even do Dysport at our practice. So just things to be aware of, though, because they do have a little bit different spreading effects, and there's slight differences between those ones. But overall, they if you're using it in like the forehead, a glabella around the eyes, they last about the same amount of time, and I haven't seen a lot of people develop resistance to one or the other very often.
No. Yeah, I can think of maybe 2 or 3 patients over the course of my career that we'll just say Botox stopped working for me.
Yeah.
So now if somebody doesn't want to go under the needle and start getting Botox, let's talk about some alternatives to Botox. Anything that you recommend that people do, whether it's their skincare routine or lifestyle, that is alternative to Botox.
Yeah, so a lot of times it depends on the wrinkles that we're seeing in the skin. So I have a patient coming in with deep set wrinkles. They've been there for a long time, and they don't want to do Botox. I'll typically recommend like a resurfacing laser or things like that. If they're fine lines or wrinkles and they're kind of subtle, I may recommend like a retinoid or Alpha Ret from Skin Better Science or something like that to try to over time smooth those out. But it depends on how aggressive the patient wants to be with it and how bad it bothers them. Because I've had patients come in with tiny little wrinkles from my perspective, and they hate them. They want to get rid of them, but they don't really want to do Botox. So I'll recommend different types of peels or lasers or things like that, and that usually helps smooth them out. We'll put them on a retinoid or some sort of retinol to help maintain that. But
I agree with that. You have to have sunscreen. If you're trying to prevent wrinkles, you need sunscreen every day.
Totally.
Lasers can be a good option, but again, you're going through a procedure with that. Retinol, Alpha Ret from Skin Better, great option. We'll have a link for that down in the podcast show notes.
Yeah.
And then there's a lot of different peptides on the market now that also help to build collagen in the skin, which can minimize the appearance of fine lines and wrinkles.
Yeah.
And there's a specific peptide product called argireline, which is designed to kind of inhibit that neuromodulator transfer. So argireline, they call it Botox in a bottle. It does not work as effectively as Botox. But argireline, you put it on there, and it does decrease the transmission of that acetylcholine from the nerve to the muscle. but
it's pretty amazing.
The results are going to be a lot less, and you have to use it every day.
Right.
Because it gets metabolized by the body.
Yeah.
So
that's great.
Another product here that we have, and this is kind of our product of the week, is the Neutrogena Collagen Bank Duo. These are formulated with collagen peptides and other peptides that help to stimulate your body's own collagen production. They act as a signaling molecule once they get in the skin to tell your body, make a little more collagen, which can help diminish the appearance of fine lines and wrinkles. These are really designed as a preventative treatment. The market for this was kind of that early 20s is kind of when you would want to start something like this. The morning product has a sunscreen. The evening product is just a good moisturizer with bakuchiol. So if you're looking for something, you're not quite ready to get Botox injections, the Collagen Bank AM and PM treatments from Neutrogena, I think are really good and quite affordable options to help your body to have more collagen and just kind of prevent those signs of aging before you have to start doing procedures.
Yeah. Well, that's great. It's good to know there's lots of different alternatives to Botox. So if you have questions or are bothered by wrinkles but don't want to go the Botox route, definitely you can go in, see your dermatology provider, and we can walk you through different options because there's a lot out there other than just poking you with a needle.
Absolutely. That wraps us up for this episode of the Skinfluence podcast. Guys, thank you so much for listening. Please share this episode and leave us a 5-star review on your podcast player of choice. I'm Dr. Dustin Portela. You can find me on all social media platforms at Dr. Dustin Portela.
And I'm Austin Lee. You can find me on TikTok, Instagram, and YouTube under Austin Lee PAC.
Thanks for joining us, and we'll catch you next time.